Okay, I believe we have a quorum. And first item is approval of the minutes, which you all received earlier. Are there any additions or corrections to the minutes? Okay, none at this point. Is there a motion to approve?
So moved.
Second.
All in favor?
Aye.
Opposed? Minutes are approved. Let's go on with the health officer's report.
Okay, hello, thanks for having me. So local trends, COVID remains low and influenza-like illness remains high, but fortunately is on the down trend, at least, I hope so, continues that way, but still certainly a lot of flu in the community, and we really need it to let up because it's been really rough this year, very severe for patients, overwhelming for the health, system. So it's good that it's coming to an end, hopefully. The other item I wanted to talk about today was just more of a national trend or concern, which is measles. You're seeing that a lot in social media and on the news. Just to start off, to say that, to my knowledge, there is no reported measles cases in Indiana, but I do think it's important to at least educate and talk about it to make sure you're protected. So measles is a disease that spreads through the air, and it's fever, cough, and a characteristic rash, and it's extremely contagious. So even more contagious than flu and COVID, if you can imagine that. If someone with measles walks into a room with 10 people who are unprotected, 9 of them will likely contract measles. So that's very, very contagious. So this has been in the news because there was an outbreak in Texas, and there were over 150 cases with 1 childhood death and over 20 hospitalizations, at least the last time I checked that data about a week ago. There have been multiple other small outbreaks across the country. An outbreak is defined as 3 or more cases. There have been cases reported in New Jersey, 1 in Kentucky, in New Mexico, kind of across the country. I think this is in part, at least in the healthcare community, garnered so much attention because in the year 2000, measles was considered eliminated in the United States, basically meaning that all cases that were identified in the US had come from an international exposure, but there wasn't a significant local spread. The best way to prevent an outbreak is through vaccination. If a person brings measles to an area from an international source and that area has a high vaccination rate, then an outbreak likely won't occur. So that's how you protect yourself. Measles is part of the MMR, the measles, mumps, and rubella vaccination that is part of the childhood series. Typically you get one at age around 1 and then again around age 4 or 5. The Wayne County Childhood Vaccination Series completion rate, at least at the end of last quarter in 2024, was 87.5%, which is a little bit higher than even the state reported amount, which is somewhere in the lower 80s. The goal really for this particular vaccine, though, is 95%. So we're still under that goal. So the best thing you can do to protect yourselves is make sure that you are protected. So if you were born before 1957, then you're basically considered immune because there was widespread measles at that time, and so you should be good. If you were born between 1958 and 1968, then they used a different vaccine back then. It was less effective, and you really needed an MMR. So you should discuss that with your healthcare provider or contact the health department. If you were born after 1968 and you received standard childhood vaccinations, which is 2 MMRs, then you are protected. This vaccine is 97% effective. So it's really, really, really good at protecting you, more so than a lot of other vaccines we generally recommend. So if you have had that, then you are protected. If you have a child that is not vaccinated, I would strongly advocate for getting that child protected now. If your vaccine series was somehow incomplete, I would definitely recommend that you seek protection through your healthcare provider or the health department, which can provide that if needed. Thank you. And that's all I have for you today. I promised I'd keep it short and sweet this morning.
You do a
One of the
great
things
job.
that people don't think about measles is there was a post-encephalitic syndrome that occurred, and I saw it since I've been around for a while. When I was resident at Riley, we had some cases, and they're tragic. People just
Very.
they die. And since the vaccines have come out, never seen it. But it can come back if we do. And it's that 95% vaccine rate's what you need to get
Yes.
community herd protection. And we're not there. We're better than some places.
And there's certainly no need for alarm right now. There's just need to make sure that you are protected. So that's what I would advocate for, is getting your vaccine if you haven't had it.
And norovirus?
I do believe it's trending down.
Okay. Any more questions? Comments? Okay. Clinical services report?
We'll just do a quick run through of how February looked for the clinic. We tested 13 for TB. We still, with case management, 5 LTBI that we were actively dealing, and then 1 active case and 0 Class Bs. So we did finish up the active case that we had had for several months. We've tested 1 for lead. We're still working with families to get kiddos tested if they've had elevated blood lead levels to try to get them under, make sure we're managing that. Unfortunately, some of the local doctors don't want to test us quickly, and we have case management guidelines where we need to make sure that they get retested if they were elevated. For vaccines, we gave 30 childhood vaccines and 82 for adults. And then for STIs, we tested 43 individuals and treated 2. We are under the 340B in the STI program. We're actively treating or testing for HIV, Hep C, syphilis, gonorrhea, chlamydia, and then treating as needed for any of those. With regards to SSP, during the month of February, we had 118 participants, just over 8,000 needles in, and about the same out. Handed out 110 naloxones, and then to add to, we did have 4 dispatch calls. So this was a part of the program where if there were needles found during operating hours, dispatch will let the health department know, and we have to go out and pick those up. So we did have 4 dispatch calls. Unfortunately, a lot of those calls are to abandoned homes where there's been squatters, not always the best situations. So we did have some of those. With regards to case management, during February, we had 133 active cases. The biggest part of those, 64 lead kiddos that we're still following up on, 17 LTBIs, so latent TB. Some of those are being treated by other physicians. Some of those have chosen not to be treated at this point. And then that includes the 5 that we were treating. Next to that, 27 Hep C, 9 Hep B, and then we did have 1 malaria case that came in due to travel to Tanzania. So, and then with regards to social media, we are still trying to stay active on that, whether it's sharing information with measles. We recently shared a study just to get some information out there on who needs to be revaccinated, etc. During February, we had over 18,000 views, 132 interactions. We reached 6.5 thousand, and we had 24 new followers. So we continue to see that grow. Starting this weekend, we will be having our first clinic at the Cambridge City Christian Church on Saturday during their food pantry. So we've made that switch to try to make sure that we're hitting the community when it's convenient for them. And then we're continuing with our clinics in Hagerstown, Ball State, Earlham, and at the schools as needed. So,
Thank you. Any questions? Okay, environmental report.
I'll try to keep it brief as well. So with housing, we're starting to see several unfit houses. We're doing a couple investigations right now with people living with no utilities. One of them is already currently trying to move out. The other 2, we're trying to assist and do the investigation with them. The food portion, our inspectors have done 217 inspections and follow-ups so far this year. Obviously, they were getting standardized, 2 out of the 3 were, so that took a little toll on that, but that's really good numbers considering we have 430 overall retail restaurants. There's only 2 convenience stores that are still unpaid for their permit this year. That's due to them changing ownership. We've been in contact with them. And then for septic, we have 2 that are still in failure. One is not cooperative, that's the one in Williamsburg, and then the other, the 180 days have passed since we first got in contact with them, and they were sent a letter and email, so we'll be following up this Friday.
Both of those could potentially go to legal, right?
Correct. Yep. That's all I have.
Mike?
Questions? Thank you. Director report.
As far as Health Indiana goes, so the advisory board that we put together, we met on February 28th. We had 9 community agencies involved. County commissioner was there, county council liaison was there, health officer was present, and 4 Wayne County Health Department employees were present. It went pretty well. It was more of a greet and meet and kind of an informational type thing. They're all supposed to go back to their respective agencies and come up with their desires, what they see as a need in the public as far as public health goes for the 26-27 era, and then we'll continue to work on that until it's time for us to put out our RFPs. It happens every time. Kicks me right out. So that's doing that. So the MOUs and contracts, I have to go the old fashioned here and go paper. So I sent out emails earlier in the week on some of the contracts and stuff we had. The first one was the Union County MOU for lead testing. Did everyone have a chance to review that? If so, are there any questions on it?
I thought it seemed pretty straightforward.
So basically the contract is that we will go to Union County. Hey, there, we're back. We will go to Union County and provide testing for them in Union County. So when they have a child under the age of 6 test at a certain level for lead in the blood, they will give us a call, and then our lead risk assessment, this is environmental only, not the clinical side, we'll go down to Union County and perform a risk assessment for that county at that particular home. And in doing that, they will reimburse us for anything that we have spent, basically. What else isn't working? Yeah, I don't know. Super frustrating. What I do with that? Here it is. So basically, it equates to we don't do any enforcement. So if there's violations found, we don't write the order. We don't try to enforce that order. We only provide the test results to Union County, and they provide all education and enforcement actions against the home. We are just there to do the risk assessments and clearance if there's cooperation. So basically, it comes down to $250 or $280 for a risk assessment and a clearance. So in a single home, if we go for the risk assessment and the clearance, it's $560 to Union County. So that covers everything from gloves. We have to use ruler tape. We have to measure out 1x1 sections to do our ghost wiping in. The ghost wipes themselves, they look like little 2x2 gauze basically that we have to test certain items with. The sample cups and lids, the bags that we have to send everything to the lab in, the recoupment of the labor costs, equipment and vehicle cost. So the standard house that we do is a 3-bedroom home with 10 to 12 rooms. It's a standard 3-bedroom home. So that cost is $280. If it's 4-bedroom or larger, we add 10% to that cost, which brings it to $308. If it's 2-bedroom or smaller, we reduce it by 10%, it takes it down to $252. So it is noted in the contract that we provide services for Wayne County residents first, and we only respond to Union County if we are caught up with our own inspections here in Union County. So,
Questions?
On those amounts, is that us breaking even or?
pretty much, there is some fluff, for lack of a better term, in there. I did up the cost just a touch for inflation, in case we have to pay shipping, things like that, but not much. Maybe 5%,
That's fine.
profit on there.
Other questions? Is there a motion to approve?
So moved.
Second?
A second.
All in favor? Aye. Opposed? Motion carries.
Next is the legal services contract. I believe I sent that out as well. That is the contract that we have with Chris's legal law firm. Same law firm Ron Cross is with. And basically what that is it's a year's contract starting in this past January and runs to the end of December. $35,000 flat fee a year, and that covers all meetings, contractual stuff like the MOUs and all that stuff. And essentially any enforcement action after that, so if we have to take a restaurant or home or whatever to court, that would be billed separately by the hour. And that is at $260 or 50, Chris?
We just changed, I believe we're at
250.
250.
250 in the contract. So most of it will be handled through that $35,000. And then I asked Chris if the health department could be billed monthly, so I'm able to track the money better instead of quarterly. So they agreed to that as well. So it's $35,000 for the annual fee, and then $250 for any additional enforcement type actions we may take as a health department. So as of right now, I have $55,000 budgeted in the legal department. So didn't account for some other things coming up, but I think we'll have plenty of funds. So, are there any questions on this contract that I can answer or Chris can answer?
Is there a motion to approve?
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? Motion carries.
The next one is the Centerstone MOU. And this is the one we've been working on for a while with Centerstone. It basically states that we will provide vaccinations that they can't provide for the indigent population. So if somebody's a patient of Centerstone's and they need a particular vaccine, then we'll provide it for them. See if I can bring that. So you can see here on the screen,
Maybe.
it's coming.
Okay.
It's
Thinking about it.
2025 and we're still not fast enough yet, I guess. So, and it's just kicking me out again. Okay.
And we'll receive that.
Yeah, it's frozen.
Review.
So there's approximately 10 to 15 vaccines on here, MMR, Hep, Tdap, the typical vaccines. This is something we technically do without an MOU. I mean, we would see indigent patients anyways, but I'm pretty sure Centerstone's a FQHC lookalike.
FQHC, yeah, and
So-
then they're a DCO with our CCBHC, so I'm sure there's some regulatory
Yeah,
requirement
it's
for
a
this. so-
person requirement rather
Yeah.
than going back and forth. So there's really no need for it. We're just helping them out to meet their HRSA requirements, basically. We provide these services whether this contract was in place or not.
And that we need to recuse ourselves.
I assume, this is Centerstone Health, so it's actually a different organization, but I can, and I will recuse from voting, so.
Is there a motion to approve?
I'll make a motion.
Second. All in favor? Aye. Opposed? Motion carries.
Yeah, and then we're waiting on an MOU from Union County to their infectious disease testing and treatment. It's already been reviewed, and all of these have been reviewed by legal and approved by legal. The STI one, the infectious disease one, has been approved by legal. We're just waiting on Union County for that. And then that one there, just to give you a little prelim on it, is they will. We're not going to charge them for labor hours, but we're going to ask them to reimburse us for any supplies that we used in testing. And if the patient tests positive, and then the patient becomes a patient of Wayne County, so we can treat, because Union County does not treat. So essentially, we'll make the money up, that we're losing in salary and stuff through the treatment process. All right, moving on from that, we'll go to KPIs. All the KPIs are going pretty well. Everybody's reporting. As far as the partners go, we continue to have meetings with Dr. Bells, the health officer, on certain KPIs. We have a meeting coming up pretty soon on trauma and injury, and there's another one on there too, I think. Suicide and overdose, I think, part of the FEMA program. We'll be meeting on April 1st for that.
What's happening in April 1st?
April 1st, we're having a meeting between Dr. Bells and people at the health department.
Okay.
To see where we are when some of our KPIs and what we're doing and stuff. Financial report. This is a little tricky one. I had a chart to show you, but the contract with Henry Schein was technically with CFID for the machines that we've talked about over the last few meetings, the $60,000 worth of machinery. So I would assume this contract is terminated, but I can't get them to let me send back the machines. It's really odd. They've cut me a check. We literally got a check and we've deposited this check. It didn't bounce. $63,225.98. But they won't let me send back their machines. So I'm still working on that. I just don't understand it. And I told the guys, like, listen, man, I have the money. They're your machines. If you want them back, I'll send them back. If not, I'll let them sit back here on my shelf. I already have the money. So believe it or not, I'm trying to fight to be able to send the machines back. So,
Stocking fee.
yeah, I guess I'm going to have to cut them 10% of that 63,000, I guess. But
They just cut their losses. They got new machines.
it's kind of odd. Henry Schein is our medical, one of our suppliers. They're the ones that reimbursed us the $63,000, but the machines belong to CFID. So it's one of those situations. So I'm waiting to hear back on that. I'm assuming it will cost us quite a bit of money to send the machines back, so that $63,000 may not be. We're going to have to spend some of it to send the equipment back. It's really heavy, really, really heavy, and I'm sure they're going to want insurance on it as well. And then some of the testing media that we have that we was going to send back is expired, so they won't obviously take it back, so we're going to have to eat the cost on that too. Still waiting on the application for the FEP grant, which is the Public Health Emergency Preparedness Grant. Still waiting on the application for the immunization grant and the FEMA grant. Still no words on those. Staffing updates. We still have a vacant public health nurse position, but we did interview. And Beth and I made a decision, and health or the HR department sent out a conditional offer to a nurse, and she comes in tomorrow for her background to start that process. So we're hoping to have a public nurse in place in a couple weeks. All right, 340B consultant, Nelco. Obviously, everything went through with that. We had our first meeting, it went well, and then we have a meeting this Thursday with him as well. And that's when we're going to start going over the documents, procedures, when we're going to have our first audit, just some general type questions with him. So far, he's been really easy to work with. All right, so next I have on the list is the SOPs, procedures that we have. The first one is the prescribing and storage of 340B medication. Has everyone had time to read and review it? And as we meet with this consultant over the next few months, some of these procedures may get altered just a touch. These are a good baseline, and we're just trying to get them in place so we can put them into practice right now. We'll adjust what we need to adjust. So the 340B, the prescribing and dispensing, basically states that we will prescribe the medication after the testing has been done and completed. The medication will be prescribed through our contract pharmacy, and that contract pharmacy will deliver the medication. It will not be put on an automatic refill. It will have to be prescribed each time. The patient will be responsible for taking the medication, and if for some reason it is sent to the health department, we put in place a procedure to make contact with those patients. 5 attempts over a 10 business day period should be made to make contact with that patient to provide them with their medication. During that time, we will be properly storing the medication per manufacturer standards.
You all received those by email earlier. Any comments, questions? Is there a motion to approve?
So moved.
Second?
Second.
All in favor? Aye. Opposed? Okay. Motion carries.
The second procedure I'd like to introduce is the EMR documenting, electronic medical record documenting. And that covers patient, and this is primarily 340B. It covers patient registration, the encounter documentation, testing documentation, treatment documentation, any communication with that patient documentation, chart maintenance, and the EMR use itself. Quality insurance, we will have regular audits on that to make sure that we're being compliant with our own procedures. And we'll review this annually or as needed to make sure it doesn't need to be modified in any way or form.
So you need a motion on this?
Yes, please. Any questions on it?
Again, you should have received it earlier. It looks like it's pretty standard electronic medical record procedures. Is there a motion to approve?
So moved.
Second?
Second.
Okay. All in favor?
Aye.
Aye. Opposed? Motion carries.
We're going to try this again. What I'm trying to get to is the budgets. One thing I did not mention here, now that we have it on here, some of our partners are joining forces to combat some of the KPIs on their own. One, Reed Hospital, Purdue Extension, Boys and Girls Club, they're all working in the health department on the Tobacco Prevention Coalition. As from the get-go, Beth is going to sit on that board until we decide if it's a good fit or not, and then she may move somebody else onto it from the health department. We're asking all partners for any success stories they have. We've received a couple of those. Here's the budgets. The health department is the local taxpayer dollars. That's where all the salaries are paid from for all the statutory positions. Health First Indiana. You can see where we sit at the expenditure, $157,000, ending balance of $1,666,000. I am on the agenda for next council meeting to do the carryover. We discussed last meeting on Reed's contract. It was only approved if that carryover was approved. So that carryover money is not listed on this yet. So I go before council to get that transferred next time I go before council. Health Maintenance Fund is the legacy fund, one that we're using to pay Work the Five with on their partnership. So you can see there we've got $100,000 left in it. Once this fund's gone, it's gone. The local health trust is right below that. It's got a balance of $68,000. Again, that's a legacy fund. Once it's gone, it's gone. Then our 340B fund, we're sitting at $876,000 right now. But again, I have a carryover from last year that will be added to this once I get before council. Harmer-Dixon Community Fund. This is the fund that Reed Hospital supplies us with, and this is how we operate the syringe exchange program. Right now, we have a balance of $30,689. And the COAG is a grant that we operated a few years back that closed down. We met all the deliverables for that grant, so the state, where we can keep that money. It's our money to keep. And we have a remaining balance of $333,000 or $37,000 in that particular fund. Again, once it's gone, it's gone. So what I'm trying to do on the money side of things, I'm trying to exhaust all the legacy funds and the funds that are going to go away eventually anyways, before I start touching any other funds. We're obviously obligated in Health First Indiana to provide those contracts, and we are providing those contracts out of that fund. But if I can buy office supplies out of a fund that's going to go away, I'm trying to buy out of that first. Health First Indiana will be here next year, so I should be able to carry some money over from it. Any questions on the budgets? This is what there.
Thank you.
Yeah. So a lot of this I typed up before I had information. We did interview 2 candidates. We advertised it on the radio. We had a heck of a time getting applicants. We started November, first week of November, and we had it posted everywhere you could post it: the newspaper, the radio, Facebook, online. HR's had it on the county website, their Indeed, and we only had 3 applicants, I think, because the one was repeat, maybe 4 applicants. So I set up interviews the first time and only had 1 show up for the interviews. And then the second time I had 2 candidates, but one of them couldn't start until August. So we need somebody prior to August. Luckily, the other candidate was a good fit. But I think at some point we're going to have a conversation with council on the pay for a nurse. Not right now, but sometime in the future. This is even for an LPN. This is pretty low pay for an LPN. If I had to make one comment at all, I think this is probably the only underpaid position at the health department. I think everybody else is fairly and justly paid. This is the only one that is underpaid. All right, that's for the next meeting. If it works, next meeting. Is there any questions? Comments? That's all I have.
Okay, and the other issue we have, we met in executive session to discuss recommendations for a vacancy on the board. And we have 2 names that we would like to put forward to the commissioners. Have you decided whose actually position this is to appoint?
We're working on it.
Okay. The two people are Emily A. Schaefer, who is superintendent at Middle Creek. We found her to be very well qualified, and we were very much like the fact that she was Western Wayne, which we feel was really on the board at this point. And also she fit the education slot extraordinarily well.
You should be careful telling her that she's Western Wayne when she's actually Middle Creek.
Middle Creek.
She represents in Western
Wayne.
County.
Western
Goodness.
I don't want to get into local.
Exactly. We don't need it.
And so the board felt she was highly recommended and would be an extremely good fit for the current vacancy. The other person is Patrick Rippenbarger. We also found him to be highly qualified, and we would send him as the alternate for recommendation. But we felt that he would be somebody that if he was not the one picked, would be somebody we'd certainly want to keep in mind for future vacancies. So, is there a motion to recommend what I just stated?
So moved.
I'll second.
All in favor? Aye.
Aye.
Opposed? Motion carries.
With that said, would the commissioners like us to present that to you? You just did.
Yeah, I was gonna say, we just did.
Nothing further needed then. You know,
Any other old business? Okay, the next meeting will be the second Tuesday in April. Any other comments or suggestions? Otherwise, I'd entertain a motion to adjourn. Is there a second? All in favor? Aye. Opposed? Thank you, everyone.
Thank you.